Hello friends, in this video we are going to discuss about the posterior triangle, how the posterior triangle is formed, what are the boundaries of the posterior triangle, it is divided into the two parts and what are the contents of the posterior triangle. So see this video to the last. Let's begin the topic. So posterior triangle, why it is known as the posterior triangle? Because it is situated behind the sternocleidomastoid muscle. And the trapezius is situated posterior to the posterior triangle. Now we will discuss the boundaries of the posterior triangle. So anteriorly it is formed by the posterior border of the sternocleidomastoid muscle and posteriorly it is formed by the anterior border of the trapezius. So that's how posterior border of sternocleidomastoid and the anterior border of the trapezius. In the middle, or you can say lowerly, it is formed by the middle 1/3 of the clavicle. Not medial, not lateral, but the middle 1/3 of the clavicle, and the apex is formed by the meeting of the anterior and the posterior boundary. Here we you can say at the superior nuchal line when the sternocleidomastoid and the trapezius muscle meets. Now, what is present into the roof of the posterior triangle? So you just remember from outside to inside, first skin, then the presence of the superficial fascia, and it also contains the nerves and the veins. Now, what are the nerves and veins which are present into the posterior triangle? So for that, let's take our nerves from our software. And here sternocleidomastoid muscle, we are viewing the sternocleidomastoid muscle, one nerve which is going toward the occiput, that is known as the lesser occipital nerve, and the root value is C2. Another one which is going towards the auricle and the root value is C2, C3, that is known as the greater auricular nerve. And the one nerve which is a transversely situated transverse cervical nerve, which root value is a C2 and the C3, and one nerve which is a supraclavicular nerve and the root value is the C3 and the C4. So four main nerves you can just remember. And the external jugular vein, it is different than the internal jugular vein. External jugular vein is more superficial, as well as the platysma muscle. You can see here, which is the very large muscle. Yeah, it's very prominent here. Yeah. So now let's discuss the floor of the posterior triangle. So in the floor, you just remember main four muscles. And for seeing these muscles, we are removing the trapezius. Now the one is the semispinalis capitis. It is situated towards the occipital. Then the splenius capitis, semispinalis, semispinalis, and then levator scapulae, just above to the scapula. And one important muscle is scalenus medius. So remember these four muscles. You just splenius capitis, then the levator scapulae, then there is a scalenus medius muscle. So these are four muscles which are forming the floor of the posterior triangle. Now, how the posterior triangle has been divided? So it is divided by one muscle which is name is the omohyoid, but not omohyoid. You can just say inferior belly of the omohyoid. There are two bellies of the omohyoid, superior as well as the inferior. So inferior belly divides it into upper part which is known as the occipital triangle towards the occiput bone, and the lower part which is known as the subclavian triangle. So remember, the posterior triangle is divided into the two parts. You can just remember the boundaries of this triangle just by seeing this diagram. There's anterior, posterior and the inferior, and for the subclavian triangle, anterior, posterior and the inferior. Now what are the contents of these triangles? So for the occipital triangle, it is named as occipital because it is having one important content which is known as the occipital artery, and the subclavian triangle because it is having the presence of the third part of the subclavian artery. Okay, fine. Now what are the important main contents of the occipital triangle? So you just remember some contents, spinal accessory nerve is there, and you can say branches of the cervical plexus which are going superficially. Actually they are passing from the occipital triangle and then they are going superficially, which we have just remembered, right? So transverse, occipital, greater auricular, those nerves, and supraclavicular. Okay, fine. And into the subclavian triangle, you just remember main the third part of the subclavian artery, which is then continues as an axillary artery. Okay, fine. And brachial plexus trunks are also present into the content of the posterior triangle. The lower part is present into the subclavian triangle and the upper part is into the occipital triangle, as well as the transverse cervical artery which is present into the subclavian triangle, as well as the dorsal scapular artery. You can just hear, as well as into the subclavian triangle you can remember supraclavicular group of the lymph nodes. Yeah, this axillary artery is a continuation of the subclavian artery. So you just can remember the main structures which are present into the posterior triangle, and occipital triangle, subclavian triangle, how they are formed, and the main contents of the posterior triangle. Here most important clinical anatomy which we need to remember is the lymph nodes. Lymph nodes are enlarged into the posterior triangle, and they are enlarged in which disease? Then the answer is the tuberculosis. It is one of the most common site for the extrapulmonary tuberculosis. Yes, the TB bacillus grows into the lymph nodes. The lymph nodes are enlarged. So most common extrapulmonary site for the tuberculosis. This is the end of the video. I hope you all like the video. Subscribe to my channel and share with your friends so they also get to know about this channel. So thank you so much.